Yesterday, when I was at work, I saw the weirdest thing. There's a flyer on the bulletin board advertising jobs for distributing newspapers, and in red marker, my boss wrote all over it that it was advertising for a human trafficking operation, and that if we saw them, we should take them down. I don't understand what an after school job and human trafficking have in common. What do they even have to do with each other?
A lot of people think that human trafficking is what we understand as prostitution, but it is a broad term that encompasses the process of recruitment and transportation of people through threats, force, and deception. The abuse of power in this situation often involves exploitation via sexual exploitation, forced labor, slavery, and even the removal of organs.
Wow, that's really upsetting. I thought things like this only happen in big cities, and I didn't realize that they could happen here, especially since it's so progressive in Minneapolis. How often does this happen?
In the U.S., there have been over 10,600 cases identified this year, according to the Polaris Project. Minnesota ranks 27th out of the 50 states. Estimating the victims and survivors of this underground system is challenging. 81% of victims are female, 14% are male, and 6% are gender minorities and unknown gender. 69% are adults and 31% are children. The average age at the start of exploitation is 19 for sex trafficking and 23 for forced labor. Minorities are disproportionately affected.
How do people even get into these kinds of situations? Wouldn't it be obvious that this is a scam?
Some of the major risk factors are poverty, homelessness, or runaway status and minority status. These individuals may desperately need a job and do not realize they're being trafficked. LGBTQ individuals are particularly vulnerable because of overlapping factors of homelessness and unemployment. Immigrants are also vulnerable due to the language barrier, low income level, lack of identification, and potential low literacy. Natural disasters, political unrest, and high crime rates contribute to increased trafficking due to related increases in homelessness and unemployment. Forced labor rates may vary with the season, such as at times of harvest. Warmer regions also have higher trafficking rates.
I'm interested in working as a public health nurse down the line. How can I work to prevent this and provide evidence-based and competent care to people who've been trafficked?
One of the ways that nurses can work to reduce human trafficking is through screening patients. Healthcare is one of the few fields where trafficking victims come in contact with an authority that can help them. Nurses can look for certain signs of trafficking in patients. For example, a patient may fear authority, be reluctant to reveal personal information, show signs of abuse, have poor physical health, and demonstrate anxious, submissive, and paranoid behaviors. Trafficking victims also tend to be accompanied by another person at their appointments.
That's great to know. What do I do if I think a patient's being trafficked?
With a patient's consent, a provider can call the National Trafficking Resource Center for additional resources to help them get to safety. If a victim is undocumented, they can apply for a trafficking visa that allows them to stay in the United States for 3 years with the possibility of permanent citizenship.
Okay, so what can I do to fight against trafficking in Hennepin County?
Knowing the prevalence of trafficking is important for identifying if interventions are even effective. So in Minneapolis, being Native American is an additional risk factor. Of all documented cases in 2013, 75% involved Native Americans, while their citywide population is only 2%. The neighborhoods with the highest incidence of human trafficking are the downtown area, North Minneapolis, and the Phillips neighborhood, which can be targeted for prevention and screening measures.